Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is the basics of disc bulges and disc herniations. The normal intervertebral disc is 80% water along with 20% proteins and collagen. There are two areas to the disc. Here you can see the annulus fibrosus, and then the inner part is the nucleus pulposus, which is more gelatinous. The annulus fibrosus does have some nerve endings and it can feel pain. There's no sensation in the inner part. The disc is an excellent shock absorber whenever we run, walk, bend, twist, flex. Everything involves compression and the water comes out of it and then it comes right back in. It works wonderfully. Unless disc degeneration occurs. It occurs between the ages of 20s to 50s most commonly due to a number of factors: obesity, smoking, repetitive trauma, such as being a truck driver. Genetics, there's an influence, and then social and environmental factors. There's a lot we don't know. This leads to loss of fluid in your discs, loss of height in the discs. So here's a healthy disc, and then you start to lose the fluid and you start to get compression of the disc, some bulging, okay? You get some tiny tears or cracks in the annulus and some pain. Now, the loss of water in the disc is almost like a tire losing air. The result is you start to lose height, and the disc can start to bulge out. Now, 35% of those between the ages of 20 and 40 have maybe this type of appearance on an MRI, but no pain at all in their back. It's important to understand that a lot of disc bulges don't cause any pain at all. If a tear occurs in the outer part of the disc, the annulus, it may cause considerable back pain, or none. If the tear is large enough, the disc material from the inside may squeeze out. That's a disc herniation. So here's a disc herniation. This is called a slip disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. It's all the same. Symptoms of a disc bulge and herniation. Most disc bulges, as I mentioned, don't cause any pain. If they do, symptoms may include back pain. It could cause sciatica due to the annular inflammation, spasms, aching. If a disc herniation is involved, it can cause a burning, searing pain, a sensation of pins and needles along with some numbness, and then maybe motor weakness, and rarely incontinence. That's actually a surgical emergency. Treatment for a disc bulge and herniation, if it's not very painful, you can basically just do benign neglect. Just kind of watch it, but not actively treat it. Over-the-counter medications can help with anti-inflammatories and Tylenol. Physical therapy and chiropractic treatment are beneficial a lot of the time. Spinal decompression therapy, which is computerized intermittent traction, has been shown to be over 80-85% effective. And then prescription medications. Intermittently, you can do a Medrol dose pack, which is a large dose of prednisone, which tapers off over 5 days. That can have some side effects, so you don't want to do that very often. Both narcotics and non-narcotic medications, muscle relaxers, neuropathic medications can be beneficial, such as Lyrica or Neurontin, and then topical prescription pain creams. When it comes to interventional treatment, trigger point injections can help decrease spasms. Intradiscal injections can be great for degenerative disc disease with bulging, and that can involve just steroid medication right into the disc. That can provide months at a time of pain relief. And epidural injections for a disc herniation, or if you have degenerative disc disease with an annular tear and inflammation here, not even a herniation. But an epidural injection is the gold standard for pain relief from sciatica. So what are the outcomes? Well, over 75% of individuals with degenerative discs and symptoms are able to avoid the need for surgery. Out of those with sciatica symptoms, over 95% are able to avoid the need for surgery. Outcomes of disc herniations at 1 year are no different than discectomy when it comes to a large study that was done in the Journal of the American Medical Association. The top non-operative pain management in Chicago is through the Premier Pain Specialists. There are several clinics, currently 7 throughout the metro area, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning providers. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching.